Hello, dear colleagues. I am happy to say hi to you this session for AI in healthcare, and I'm honored to talk together with Mr. Dmitry Dyrmovski, representing CRT. Dmitry, you are on air. Good. Just wave and say hi. We have very good experience working together when, together with CRT, we worked on the scientific and methodical support of to analyze the rhinologist's voice and giving CRT millions of protocols to improve the quality of voice recognition, and thus we've improved significantly the recognition accuracy, and we have now hundreds of doctors describing the research, and even people with senior age use the voice recognition systems to both interact with the workstation and to formulate the protocol. Of course, the infrastructure is important, and implementation, working together with the right business partners, is paramount. Moscow plans to make AI a norm and working with here, and that's part of the practice. More and more doctors use that technology, and you need to make it based on starting from scratch. Analyzing computer and data, analyzing CT, developing the infrastructure are important. We also need to get new areas for analysis using the AI technologies. 150,000 distant descriptions and audits are made, more than 500,000 telemedicine events. More and more heart protocols are analyzed, and analyzing the diagnostical data is getting more and more effective. And we have a reference center, a telemedicine structure that provides distant work for working with medical organizations. So here's an example of rhinologist, X-ray specialist. We see a person still holding a mouse, but an important part here is that you can use this technology to standardize the protocols, use the instrument that is very natural, and improve the ergonomics. And with the tool that we use, it's either a headset or just a mic. Someone is pressing the buttons. Sorry, don't hurry me up. This thing can be used to manage the workstation. So, Dmitry, you have the floor on how you use the technology. Thanks, Sergey Pavlovich. And the voice recognition technologies are obviously among the ones that are used actively in medicine, and based on what the colleagues say, this is really has to do with medicine. And we have succeeded in creating a product that is needed by doctors, and Sergey Pavlovich has said that the doctors can spend up to 1/4 of their workday just documenting. We see more and more protocols, more and more symbols getting into the system through our new approaches. You cannot actually make a successful product without working actively with the doctors. There is a huge, it is a huge achievement by the Moscow management, Moscow leadership, and the healthcare team, because we've got a huge amount of data and we're able to improve the speech recognition quality from 92 to 95 and then 98%, and they now get a very highly efficient way to accurately convert their speech to text. And we need to train them to do so starting with students, and the customer that wants what they want to get is super important here too. And a team, both for the city center and our team, worked really well to create that technology, and we are implementing in Russia, across Russia and even other countries. And Moscow, of course, is leading the way. Sergey, thank you indeed. Dmitry, thanks. It was a really interesting thing working with us, and we now work more with the other types of lab research and analysis. But to comment on the clinical trials, we have done this, and we're now scaling this clinically, and it is approved for 2 users. And even the specific terminology, like the doctor saying 80 Hounsfields, then the system knows the terminology, so it converts this to 80 HU instead of just writing it word by word. So we are aimed at the comfort. We are aimed, and second part is computer vision. We will now process the number of different areas, and we now have a site with the up-to-date data being published. We have 21 companies providing 39 different services, and 19 are part of the special package for the libraries, and it's a real clinical real part of clinical practice. We definitely have high flow of the users and of the data, so this allows us to provide results to the doctor even before the description is done. And this is the highest scale of using AI in medicine, both for the clinics and for the hospitals. So, and the doctors are getting used to this. So here are the numbers for all the organizations we've connected, and comparing this with the COVID-19 services we had based on a data set. Those curves which show you the accuracy of CT diagnosis and calculating the sensitivity and specificity. It is very important to compare that research and benchmark that research, because analyzing those pictures is a tool that you need to know the limitations of, because you can put it on screening, on the the diagnosis. So the doctors that just heard about some algorithms would think that they are being replaced. No, this is not true. The algorithms help you to analyze the research and mass results. And we, of course, have plans to scale the algorithm. This is done by the government of Moscow. We have plan to launch new services, and the algorithms definitely help the doctors to reduce the description time, to reduce the diagnosis time, and the data sets to test the algorithms are important. We create standards for the clinical trials. We have a committee to ensure standardization in healthcare is done for the technologies we use in AI, in healthcare all over Russia. We also certify internally and train people. We announce new algorithms being connected. So this is a huge amount of data. We create new modalities and types of illnesses. I hope we will have 10 computer vision business lines, new functionality with scaled experience to the other countries. And people expect those technologies to be implemented because this is a higher level of automation and standardization. And these technologies are quite well trusted, but it's important, of course, to the doctors, for the doctors to be using those technologies. And it's not correct to give them to patients that cannot understand why the algorithm or how the algorithm works. So the doctors should be empowered with those algorithms. And it's important to publish the results. We publish a lot of things with our partners from different hospitals and centers, and those researches are important to assess how accurate they are, to get feedback and create practice to apply them. We prepare a platform also to test AI and computer vision algorithms. We get new business lines, and we have already started an online battle of the AI against the rentgenologists. Hopefully we will end up partnering with AI. We create a lot of clinical recommendations, and we launched the new standards. The infrastructure is being implemented. The correct clinical trials and working together with the industry partners is important. Thank you for your attention, colleagues. So, yeah, computer CT and MRI usage is a place where computer vision definitely can help. But with the cardio functions and functional diagnostics, what do you expect? The same amount of the same results, same approach? Yeah, we are actually applying, launching the project to put all the data to the national information system to ensure that the ECG is passed into the system automatically, and we will be happy to see other companies joining us. We are creating data sets. We test it and putting it to EMIAS, to Global Russian Information System, and for endoscopy and other places. We are launching this with dermatologists and so new medical specialties.